The federal government is approving pump price guidelines, and this is to cushion the effect of COVID-19. According to a release by the Petroleum Product Pricing Regulatory Authority, that's the PPPRA, the new guideline will apply to all retail outlets nationwide for the month of April 2020. Now, that guideline says motor spirits PMS pump price will now be 123 naira 50 kobo, which means government is bringing the pump price downward again from its current price of 125 naira per litre. Now, according to the Executive Secretary of the PPPRA, Mr. Abdul Kadir Saidu, members of the public and all oil marketing companies are to be guided. Also staying with efforts to cushion the effect of COVID-19 in the Federal Capital Territory, the federal government has commenced the disbursement of 20,000 naira conditional cash transfer to indigent Nigerians. And some are reporting that it's 10,000 naira actually, talking about the cash transfer. Now, the Minister of Humanitarian Affairs, Disaster Management and Social Development, Mrs. Sadiya Umar Farouk, while kickstarting the disbursements at the Kwali Area Council, explains that due to the scourge of the COVID-19, the federal government is giving out the sum per person for the next 4 months, starting from March 2020. Well, for the National Human Rights Commission, the NHRC, they've asked all Nigerians to report any cases of violations of human rights abuses by law enforcement agencies during this period of the pandemic. According to the Executive Secretary of the Commission, Mr. Tony Ojukwu, the report must include location and time of violation, the date, and a clear description of the alleged violator and their victims. It also states that it is important to include the gender, possibly name and rank of the security personnel to enable the Commission take appropriate action. The Commission listed Lagos, the Federal Capital Territory and Ogun State as a focus states following the presidential lockdown directive. Complaints of violations regarding military personnel are to be directed to the Director, Army Civil Military Affairs on the telephone number you can see on your screen. That's 0805 775 0691. 0805 775 0691. In the meantime, each of the 360 members of the House of Representatives, they've resolved to donate 2 months of their salaries to the fight against the COVID-19 pandemic in the country. This was announced by the Speaker, who says the donation will be independent of contributions by individual lawmakers to alleviate the hardship faced by their constituents. According to him, beginning with the March salary, the lawmakers' donations will be transferred directly to the National Relief Fund account for the fight against COVID-19.
We have in the House of Representatives jointly committed to contributing 100% of our salaries for the next 2 months to the fight against COVID-19 in Nigeria. Our contribution will support provisions for the welfare of frontline medical professionals and health workers, and other interventions to provide for the well-being of Nigerians through these trying times. Accordingly, I have directed the Clerk of the National Assembly to see to it that all members' salaries are transferred to the National Relief Fund for this month and the next. This is independent of ongoing individual efforts by members to alleviate the suffering brought on by this virus and to improve the living conditions of citizens in their various constituencies. The House also calls on the Central Bank of Nigeria, as part of its policy measures in response to the COVID-19 outbreak, to immediately direct cash grants to the 774 local government area administrations in the country to provide food and other essentials to at-risk individuals and communities.
Well, we go over to Abuja, where our correspondent, who also gives us updates with the House of Representatives, Terry Kumi, joins us now. Hello, Terry. Now, on the donation of salaries by the House of Representative members, 360 of them, do we have an idea of the figure in total that will make up the donation for the National Relief Fund account? Because there's been a lot of controversy as to exactly how much their salary is.
Well, hello, Millicent. That's a very good question. It's good that we put figures to the statement from the House of Representatives. Let me just let you know that on the average, the salary of a lawmaker is about 450,000 naira, which is about half of that of a senator. So if you multiply 450,000 naira, the speaker inclusive, by 360, you have about, say, 162 million per month. So for the 2 months that the House of Reps has offered to donate its salaries, that would be about 324 million naira put together. And that's just salaries. It has nothing to do with allowances or other running costs. And one thing the speaker also said in that statement was that the House would be carrying out oversight function on the monies that have been donated so far. It raises the question whether the House has the powers, or the National Assembly has the powers to oversight monies that it did not appropriate.
All right. Also tell us the enforcement of the lockdown taking place in the Federal Capital Territory where you are, because until last night, reports we were getting in suggest that there hasn't been the full compliance in this case. What's the case now?
So yesterday, the leader of the task force team gave an 85% compliance rate. But from what I observed this morning, it seems we have more cars on the roads and more people standing by the road waiting for vehicles. It's not clear whether they are all on essential duty or not. In fact, I saw taxis picking up passengers this morning, and get this, bikes have returned to some of the satellite towns in the FCT. In fact, close to us here, Gusape, we see bikes at the Gusape junction just next to the SARS office. The situation almost suggests that residents here monitored the lockdown yesterday and concluded that it wasn't that tight. And listening to Ibrahim's update last night, where he mentioned that the satellite towns were not really observing the lockdown, I spoke with the leader of the task force team this morning, Mr. Ekaro Atta, and he told me that the task force would be extended to the satellite towns today. He specifically mentioned from 12 today. He also mentioned that somewhere in Yanya, the traders insist on opening the markets, but his team will ensure that that doesn't happen. From my conversation with him, it does appear that residents of Abuja think that this is a public holiday. Some even go as far as playing football in the open. And I think it's important for government to clearly spell out penalties for defaulters, because there seems to be none. And Mr. Atta also told me that vehicles would be impounded and fines imposed. You find security agencies that are stopping cars but not pedestrians. It raises quite a lot of questions.
It's not a public holiday. These are measures to curbing the spread of COVID-19. Well, we'd like to thank you, Terry Kumi. We'll touch down with you a little later on. Well, it's the second day of the lockdown in Lagos and Abuja following the president's order on the restriction of movement and travel, except those on essential duties going about their businesses. We hear a combined team of military, police, civil defense are at different border locations and also enforcing these measures. But in Ogun State, also one of the states covered by the presidential directive, according to the governor, they are preparing for a total lockdown with effect from Friday, the 3rd of April. Our correspondent, Ini John McRae, she's in Abuja and is live for us in the Ogun State capital. Ini, what have you seen around the city center, and what do you think the level of awareness is as to the lockdown to come on Friday?
Thank you so much, Millicent. Well, here in Ogun State, it seems life is still normal. We went to the market earlier, and we can see the women are still in the market. But there is also a high level of consciousness. We met some people who have come to the market to buy, and they say they're trying to stock the house as much as possible. There's the complaint of hike in prices. So I tried to speak to some of the sellers to find out what's causing this, and they say, well, the government had told the transporters to practice social distancing. That means in their cars, in their tricycles, they cannot take as many passengers as they ought to, so they increase the price, and that is passed on to the commodities in the market. So they are calling on the government to intervene. They have just about 2 days to stock up before there's a lockdown in Ogun State following the federal government's directive. But so far, the roads are busy as they used to be before now. And there's high consciousness of COVID-19, even though some people are still skeptical about it, and some people say, well, they should be allowed to take the risk. But we have a representative from the executive of Ogun State government. He's the senior advisor to the governor on media, Mr. Remy Hassan. He's going to tell us some of the preparations. What are some of the preparations you have put in place for the people at this time?
Well, thank you very much, Ini. The first correction I would like to make is that the roads are not as busy as they used to be, because quite a number of our people were prepared to go into the lockdown from Monday, but for the intervention of the governor, for some bit of space to be given to the state, for a number of those that have not been able to stock up, as well as those that need some palliative from government. Also for the government to be able to put measures in place to be able to put the logistics that will get those palliatives down to Ogun State. For us in Ogun State, we have been prepared long before now, but every day that new discoveries are made about this scourge, we heighten and escalate our preparedness a lot more. For today, we have well over 300 prepared isolation centers, and all the isolation centers, apart from 2 that are gifted to us, the 3 that the state owns are both to isolate and to treat, whereas the other ones will just isolate. Once the patients are tested and they come down negative, they will be treated for other ailments that they may have, and they will be discharged. As a state, we also have gone one step further, complying with what the president has said, which is that all the borders into Ogun State, the border with Lagos, borders with Ondo, with Osun, with Oyo, as well as the international boundary with the Republic of Benin, have been on lockdown since the 11 p.m. On Monday. That instruction was to go into effect. So we've been good, and what you are seeing now is just last-minute effort by people just to be sure that they are far well more ready to go into this lockdown as instructed by the presidency.
All right, thank you so much, Mr. Hassan. Well, I would have loved to find out the palliative that the state government is putting in place, because a lot of people are still asking for that and asking where are the centers for food. Food is one of the major things that the people are asking for during the period of the lockdown, as we have seen in other states. Well, that's the much we can take from Ogun State. Back to you, Millicent.
Many thanks, Inni John McQuarrie there with the latest on how Ogun State residents are preparing for Friday, when there will be a total lockdown. Still to come on the program, we have more from other states on their level of preparedness, plus there appears to be more trouble for the U.S. The country is recording over 4,000 deaths of COVID-19. Please join us again. Welcome back to the program. Now we go into discussions. Joining us for more on efforts to curbing the spread of COVID-19 in Nigeria is a public health physician. Professor Titus Ibekwe is also a public health specialist. He joins us via Skype from Abuja. Thank you for joining us on the program. I'd like to get your point of view. If you've spoken to people around you, what do you think the level of awareness is? I mean, do people have the right information on staying safe this period, or for them is it a public holiday and they're still meeting friends and all the others?
Yeah, Millicent, thank you very much. I think Nigerians should understand the peculiar nature of what we're dealing with here, which is the COVID-19 disease. It is really different from other illnesses. This is a disease of an equal opportunity, and at the same time, a disease of nature and nurture. And that's why it is non-discriminatory, it is classless, and at the same time, we should realize that the two prongs of managing this has to do with both the health impact, which is what we're doing right now, and also the environmental and the psychosocial economic aspect. And that's why holistically this should be addressed. So the issue of lockdown, which is on right now in FCT where I am and in Lagos, is a welcome development, and it's expected that everybody should key into this. But this is, strictly speaking, a means but not an end. It is a means towards achieving, creating this platform to tackle the disease and the illness. And that's why everybody has her own role and
to play.
Responsibility towards doing. So
Professor?
Nigerians.
Let me quickly ask you, this is a pandemic that appears to be testing our government and also our economy like never before. But what more do you think our leaders should be doing to make things better for the people?
Yes, that is the nurture aspect of this disease. Everything possible towards alleviating the social problem and the economic impact that is associated with this problem has to be done. Yes, people are at home, but they have to be encouraged. That is one. And secondly, we cannot get tired of, escalating these issues over and over again so that they understand the need to stay indoors. But again, somebody who is hungry without may be forced out of his or her home. So I think knowledge is very important here. And that's why the orientation agency, they say, have a lot of job to do. And the media, just as we're doing right here, have a lot of job and health education to impact on our people. And of course, I was very happy when I heard that there's going to be some palliatives that the government is planning for the populace. This should come up immediately and come up promptly, to encourage them to stay back. Let's not forget that there are peasants who are at home who depends feeding from hand to mouth. It's on daily activities that their daily subsistence that they live on. And lockdown for 2 weeks is scientific. We know the reason why it has to be 2 weeks for a start, given the length of period that is needed for incubation of this illness. So this 2 weeks is a must, which may be extended if need be when we evaluate and reevaluate. So the support coming from government should be done very fast and very handy so that people will not have any reason to flout this law. And again, the law enforcement agents, they have to be humane on the populace, not necessarily forcefully, causing bodily harm or injuries and psychological trauma on anybody. But they should be all there to guide people to ensure that we all comply, by these rules and regulations that have been put in place. It is just over a matter of time. We'll get over this, but it depends on how we're able to, impact and, assert the necessary steps. Because we are talking of a lot of things on the part of government, also not just on the part of the populace. We need more testing centers across the country. We need to escalate this. We can see some effort being made, but it's still not enough. The minimum is that we have to target at least to have one test center per state, and that will be as quickly as possible, so that we go beyond just testing only people who are already
severe or showing symptoms. All right. We'd like to appreciate your time, Professor Titus Ibukwe, Public Health Specialist. Thank you for joining us at this time. Also, with staying with efforts at preventing the spread of COVID-19, Plateau State, local government there, Langtang North local government, they've commenced fumigation of the town and also other facilities in accordance with maintaining a high hygienic standard. Here's our correspondent, Yemi Kosoko, with more.
You are welcome to the Ponzita Rock Palace in Langtang North local government area of Plateau State, where the fumigation exercise has just been flagged off by the local government chairman. As you can see, we have fumigators that have been equipped with motorized sprayer, and they are to take care of passengers and motorists coming in and out of Langtang. This is a novel exercise, and we have the Langtang North chairman with us, who will tell us the essence of this exercise. Mr. Chairman, you're welcome.
Thank you, Yemi. The essence of the exercise is preventive measures. We are trying to prevent the deadly coronavirus, COVID-19, into Langtang, and sanity, personal hygiene is more important. The preventive measure we have is to prevent it and to be personally involved in our hygiene. Personal hygiene is most important, because we don't have good medical facilities in Langtang, and in Nigeria as a whole. If countries like Spain, Germany, Italy, China, USA are ravaged, who are we? We must take our hygiene in our hands. That is the reason why we flagged off this massive fumigation exercise to control our own germs within the local government.
Thank you very much, Mr. Chairman. And of course, apart from the chairman who has been able to flag off this, the chemical, people have been talking about the issue of the chemical, whether it's injurious to human beings or not. The company that is handling the fumigation exercise, we have the marketing manager. What can you say about the issue of this chemical? How are they friendly to human?
The chemical is completely friendly to human beings. It has no harmful effect. It is the collaboration is done in a way that it's completely friendly, and it targets only the diseases that we want to eradicate. So it's targeted towards the disease and not against any human existence. So it's quite friendly. Yes.
Yeah, thank you very much. Yeah, you've heard it, and from Langtang North local government area in Plateau State, where the exercise is to take place along the major streets, worship centers, and of course the marketplaces are to be fumigated. The exercise will continue in the course of the week. Yemi Kosoko, Channels Television News.
Well, globally, there are now more than 800,000 confirmed cases and more than 42,000 deaths. And this is in the United States. The brighter side, or rather 42,000 deaths globally now. We're having the U.S. recording over 4,000 deaths, and there are fears that indeed that number could go higher. In Burundi and Sierra Leone, they become the latest African countries to record their first positive results. Let's go over to the World Health Organization's website, where they are live each day with regards to updates on the pandemic each moment, depending on where you are, the number of cases, also the number of deaths. And we're seeing the regions and areas where indeed cases have been recorded. The World Health Body is still calling this a pandemic and saying that the level is very high. You can take a closer look at those numbers and several other information in real time. Well, that's our COVID-19 update at this time. Thank you for watching. Don't forget, we have another 30-minute update, and that's at 6 p.m. and a 45-minute update at 9 p.m. I'm Millicent Walker. Bye for now.